The connections between overexcitability and psychiatry are so strong. And beyond that, like overexcitability has interesting connections like with synesthesia and epilepsy and chronic pain. Like there's so many medical links with overexcitability that have been completely ignored and unexplored.
When people hear the phrase positive disintegration, it can sound a little confusing, even like a contradiction. But what if this idea could actually help us better understand neurodivergence, personal growth, and the winding paths many of us follow as we work toward authenticity? How does Kazimierz Dąbrowski's theory connect with ideas like overexcitabilities, giftedness, and neurodiversity? And how can we talk about intensity in a way that's validating without either romanticizing it or treating it like something that needs to be fixed? Dr. Chris Wells is here to help us explore these questions and clear up some of the misconceptions about Dąbrowski's work. That's straight ahead on episode 277. I'm Emily Kircher-Morris, and this is the Neurodiversity Podcast.
What is neurodiversity?
You see the world differently.
Autism spectrum.
Gifted.
Complexities that are inherently inside.
ADHD.
Dysgraphia.
Tourette's.
All brains are different.
You are exactly what this world needs.
This is the
Neurodiversity
Podcast.
You know, one of the things that I love about our community is how many of you are out there actively looking for ways to better support neurodivergent people, whether you're a teacher, a clinician, a parent, or someone who just cares. And if you've been looking for resources to help on that journey, I want to remind you about the courses we have available at Neurodiversity University. We've got topics like supporting twice exceptional learners, understanding dyslexia for educators, and even a CE course on the foundations of neurodiversity-affirming therapy for clinicians. There's truly something for everyone who wants to create more inclusive spaces. You can check them all out at neurodiversity.university. There is a link in the show notes. Dr. Chris Wells is here with me next.
On a recent episode of the Neurodiversity Podcast.
You know, the historical approach, particularly with neurodivergence, has been the overarching goal is how do we make you stop being neurodivergent? How do we make you, it's a meaningless term, but how do we make you act normal? How do we make you stop inconveniencing the people around you instead of how can we support you? What are your goals and values? And understanding that internal experience of living as a neurodivergent person in a world that's not designed for your brain. So there's been a lot more vocalization from neurodivergent communities of why would you do this work without centering the people that you're supposedly here to help, basically.
That's episode 251, Moving from Traditional to Neurodiversity Affirming Therapy. Find it wherever you get your podcasts.
Today, I'm talking with Dr. Chris Wells. Chris is a writer, researcher, and podcaster whose work focuses on positive disintegration, neurodivergence, and the journey of personal growth. They're the founder of the Dąbrowski Center and the driving force behind the Positive Disintegration Network, where they've been instrumental in bringing Kazimierz Dąbrowski's theory into both academic circles and broader public conversations. Through their podcast, Positive Disintegration and Cosmic Cheer Squad, and their writing on Substack, Chris makes complex ideas deeply relatable by connecting them to real-life experiences of transformation and self-discovery. Chris, I am so glad you're here. Welcome to the podcast.
Thank you so much for having me.
So you and I have known each other for a while through the gifted education community, which is how I came to the broader work I do in the neurodiversity community, which I think you do as well. It's kind of broadened and expanded beyond that. But our conversation today is one that really elicits some strong opinions from people, although we'll get into that in just a little bit. I want to start us off just with the basics. Can you describe what is Dąbrowski's theory of positive disintegration? And how would you describe it to someone who's never heard of it, but might be familiar with ideas like neurodiversity or giftedness?
Well, the theory of positive disintegration was developed by Kazimierz Dąbrowski, like you said, and he was a Polish psychiatrist and psychologist who experienced his own strong overexcitabilities and inner conflicts. And, you can tell that from his writing that the theory came both from his lived experience and his work as a clinician. I see him as a forerunner of the modern neurodiversity movement in some ways, because he had a take on, well, the symptoms of mental illness, but beyond. He worked with children. He worked with hospitalized children, especially in his early clinical work, and then later worked with adults. Like now we have the DSM, but when he was working, they were still trying to figure out what these causes of suffering were. They use the term psychoneurosis. And so since he died in 1980, all of his work uses kind of older terms of psychiatry, in his day. But basically, the theory looks at two developmental processes, unilevel and multilevel. And unilevel being more somatic, less conscious in one's awareness, and multilevel being a whole different kind of inner conflict. And basically, he saw these symptoms that other people saw as mental illness as signs of developmental potential, or the potential for transformation and growth, And so really, it's really a theory of personal growth at its core, inner transformation. And there are 5 different types of development that he outlined, but I don't even want to go down that path. My work with the theory is so different than what most other people do. And so I don't even want to go into talking about it in the same way that other people do. Mm-hmm. And that's kind of where I am right now in my work. I'm in a strange time of figuring out my own direction forward with it. And, with colleagues who aren't necessarily from the gifted field at all. But overexcitability, that's kind of the connection with the gifted field especially. And so the overexcitabilities existed before Dąbrowski. They came from the concept of nervousness, and he differentiated them into 5 types. And they are also seen in other types of neurodivergence, autism, ADHD. And that is something that I explored deeply in my work when I first came to this, because I discovered the theory as somebody who was like in middle age and trying to figure out my own history of I was identified as a gifted kid as a child, but then I spent my 20s in and out of mental hospitals and a long journey of psychiatric treatment, and was on disability for a decade. And so for me, by the time I was in my 40s, I was like, how could I be gifted and mentally ill? That was the thing I was trying to understand. Mm-hmm. And then when I finally dove into the theory and read what Dąbrowski was writing beyond what I'd seen in gifted ed, I was like, whoa, this is so much deeper, and helped me reframe my whole history and have so much more compassion for myself. But then I also started making these connections with the neurodiversity movement, and I was like, this is so misunderstood in this field. And, it's been quite the journey.
I remember I was first introduced to the idea of overexcitabilities, was probably honestly the first entry point that I had, because that was what was presented. And I was at a conference specific to gifted educators and parents. And it resonated. It resonated personally, and it resonated with the kids that I was working with as an educator at the time. And as my own awareness grew, as my understanding of this grew, and in the process of this, I was also then, I don't remember exactly when that was, but I went and got my second master's in counseling, which was more focused on the psychological side of things. And I ended up having this disconnect a little bit between that idea of the overexcitabilities specifically, which was kind of this thing that was pulled from the theory of positive disintegration, and what I felt like the wider psychological field was aware of or understood. Then we have kind of, I feel like in this gifted ed world, there is a little bit of this bubble where people talk about things to themselves, but don't get outside of that as much as maybe would be beneficial. And that's where some of this controversy comes up that I kind of mentioned. And so one of the areas specifically is whether or not Dąbrowski's work, specifically these overexcitabilities, relate more to other similar mainstream personality frameworks, for example, like the Big 5 personality model. That's a big one. We actually did an episode on this, episode 147 with Dr. Alex Fuick. We'll link it in the show notes if anyone wants to go listen. But one of the main critiques is basically people mention something called the jangle fallacy, which in this context is talking about calling two things by different names, even though they are describing the same traits. So what is your take on this? Are overexcitabilities, which maybe we should elaborate on a little bit, and the big five just different labels for the same things?
You can see like some connections between facets of openness and overexcitability, but overexcitability, if you look in the medical literature, it underlies so many different types of neurodivergence. Like, I mean, just ADHD, for example, the psychomotor hyperactivity, impulsivity, sensual overexcitability, huge overlap with the sensory issues of various neurodivergence, the emotional regulation issues of ADHD, emotional overexcitability. Like, there's so much overlap there. And like with autism too, I mean, it makes so much more, like for me, I could never even wrap my head around the idea, like how was openness to experience? How did that lead me to the mental hospital? I mean, how did that lead to the suffering that I had? Like that was, I think, my biggest disconnect when those papers came out. And then, gosh, there's so much there to talk about. The connections between overexcitability and psychiatry are so strong. And, and beyond that, like overexcitability, it has interesting connections like with synesthesia and epilepsy and chronic pain. Like there's so many medical links with overexcitability that have been completely ignored and unexplored. It's baffling to me that we're even in this place where we have to say that it's not only for the gifted. Mm-hmm. Like positive disintegration, I can tell you as a podcaster now who does a podcast around this topic. Mm-hmm. I mean, people write to us from all over the world who may not be gifted and who definitely have experienced the kind of suffering that Dąbrowski talks about in the theory. And so they hear our stories and they're like, well, at first, people would be like, well, maybe I don't have overexcitability because I'm not gifted. And it was like, well, I mean, of course, if you see yourself in this, like it doesn't matter. And yet, like I can tell you the pushback that I've had from people in the gifted field around this, like they just do not want to believe evidence and data. Like there's just no convincing some people that this isn't true.
Well, I always appreciate the nuance that you bring to this conversation. And I think that is something that often is missing. And when you don't have that is, I think, how sometimes people, they get one little piece of it and then make their own connections, but then it's hard to let those things go. One of the reasons that overexcitabilities, especially in the gifted education community, and again, recognizing that there are people who will not agree with this or have a hard time with this, but the gifted ed world in many ways is very ableist. And that is a difficult thing to wrap your head around because, again, I came from the gifted ed world. That was my passion and in many ways still is. But what I think has happened is that because of some of those ableist beliefs, as in if you're gifted, we don't want to pathologize your giftedness. We don't want somebody who's gifted to go to the doctor and be diagnosed with ADHD because they're distracted in class because it's underneath their challenge level. Fair enough. However, the way I ended up seeing it being used was people were taking some of those overexcitabilities that you were talking about. For example, intellectual overexcitability, and they were conflating that with some of those special interests that people who are autistic experience. Or they were taking that psychomotor overexcitability and again, saying that, oh no, that child can't be ADHD, that's just their psychomotor overexcitability. And I feel like that's part of how that got wrapped up, as opposed to just understanding it within the context of neurodivergence more broadly. And in so doing, then that became kind of how people in this gifted ed world understood this. But I will admit, when I first started my counseling practice as a mental health clinician, I was specializing in giftedness. And I had clients coming to me who I know were clearly ADHD or autistic. They were twice exceptional. They had another layer on top of that giftedness. And I didn't know it. Again, this was a while ago, so our understanding has come a long way. But also, I explained some of those things away. Just exactly what I was just saying. That can't be ADHD. It's probably just this other thing. I remember there was a client who eventually we figured out what was going on, but I was missing a bipolar diagnosis. Now, my job as a mental health clinician in those situations, I'm a therapist. I'm not assessing for those things, right? But I'm obviously on the lookout for them. And that's definitely what caused me to start having some pushback against this because I realized like I'm not best serving my clients through this lens.
That's been such a huge problem in the field. I mean, we can only speculate about how many people's journey of self-discovery has been derailed to some extent because of this. Our episode that we did, episode 30 with Katie Higgins-Lee on positive disintegration, we addressed this as we both talked about like the misdiagnosis book as like an enemy on our paths because, you know, it throws you off and you think that it's really something else. And I mean, I have seen cringe videos and stuff from the past of people saying like, no, the hyperactivity of ADHD is different than our precious psychomotor overexcitability. And it's like, it's not. I mean, if you read Dąbrowski's work and it like, especially though his Polish work. And so I really dug in. That's just who I am. Like, and again, like, because this theory explains so much about my history of perceived mental illness, I really dug in because I'm like, what's happening here? Like, who's right about this? Like, maybe it is just pseudoscience. Like, I really had to figure it out. And my conclusion was, if you really dig in and see what was being talked about, you can see that he was talking about mental illness. I mean, the theory was meant to humanize people who were, like, think about it. Okay, so Dąbrowski, born in 1902, lived through both world wars. I mean, it has been kind of horrifying this year to see, like, the eugenics that we're about to face here in America again. I mean, this is what was happening in Poland when he was developing this theory. You know, Nazis had occupied Poland and were killing patients. Like, he was once like director of pediatric neuropsychiatry at a hospital where many of the patients had been exterminated during World War II. And so in his mind, as he's developing this theory, he is saying these people have worth. There are blessings to having this kind of experience of, you know, heightened intensity and sensitivity. This is not like psychoneurosis is not an illness. I mean, that was like his essential thesis. This is what this theory is about. It's not about this is a gifted kid, exactly. Like, there has been a misapplication of the theory and a misunderstanding around it. And I think that's why I was so frustrated. I was like, no, we can't just throw this away. Like, there's something really valuable for people. And yet I also totally could see what the critics were saying because, I mean, I too can recognize that there have been huge problems in how the theory's been interpreted in the gifted field.
Can you talk a little bit more about the positive disintegration portion of the theory of positive disintegration? Let's dig into that a little bit, because I think you would agree that this is the important piece. This is the piece that really shows us about humanity in really amazing ways.
Yeah. So, I mean, basically, people who have strong overexcitabilities, even when they're children, tend to be misunderstood. They tend to be pathologized for their differences, just like we still see, you know, neurodivergent kids. Like, yeah, they're hard to wrangle in the classroom. It's hard to get them sometimes to like do what they're told. And so that causes conflict both internally and externally. And of course, sometimes people don't experience strong conflicts until they're older, maybe like puberty, adolescence. And for some people, they don't have like strong conflicts until they're even older. You know, sometimes like other changes in life, like menopause, you know, or middle age or whatever, also can cause disintegration. But basically, disintegration is just, a strong experience of like fragmentation, and which can happen in so many ways of like feeling like you're going through a breakdown, or even like it doesn't have to be like a strong, you know, disintegration that's a breakdown that leads to a hospitalization. It can just be like the dismantling of what you used to believe. It can be that something has happened to make you rethink everything about what's going on. Like maybe some trusted authority figure, like you suddenly see through them. Like there's a million different ways that really disintegration can happen. It can happen because of something traumatic that happens to somebody. The usual first, well, he called them dynamisms, like these are what shape, you know, the experience of disintegration. And in a lot of ways, it's like ambivalence, you know, self-sabotaging behaviors, ambitendencies, he called them. So he had like a whole vocabulary for the different dynamisms and types of disintegration. Like there's a lot to it. But basically, that's what it is. It's like these signs, and the experience even of breaking down to him was a positive thing. It meant that there were processes of growth happening. And so for Dąbrowski, like he would take a patient, client and say, these are positive aspects, like and talk about the overexcitabilities as driving these dynamic processes within them. And so, I talked about there's two main types of development and like the multi-level type of development has much richer and more transformative dynamisms where the unilevel, like ambivalence, in a unilevel kind of horizontal way, like values are really the heart of the theory. And so if you don't have a values hierarchy, it's not clear how to get out of your suffering. You can recycle the same problems in your life, keep replaying the same patterns without freeing yourself from them. Mm-hmm. The multi-level development is much more conscious. It's more in a person's awareness. And the dynamisms are also the path out of suffering and through transformation. And so that's been really a blessing for me personally, to see how my experiences of suffering when I was a mental patient in my 20s, there was so much ambivalence. I was using drugs. I didn't have a clear values hierarchy guiding me out of being an addict until one day I did, and I had basically a moment of illumination when I was like, I don't want to be an addict anymore. I have got to get it together. And I did. But essentially the dynamisms come from the overexcitabilities. The overexcitabilities are the raw material to produce them. And they're emotionally, cognitively based. And so that connection, not to point again to gifted ed, but I've always been how has nobody talked about this fuller theory that helps experience suffering in new ways that are actually so helpful for people outside of the medical model?
Mm-hmm. When I think of positive disintegration, I think of something breaking down, it's falling apart. But then the positive part is not happy, oh, it's so positive, but it's about the growth. It's the progress. And in some ways, the way I've also interpreted this is that this is also along the path to something like self-actualization. I don't know if Dąbrowski had a term specifically that he would have used or if that's aligned in the way that you understand it.
It's a hierarchical theory. That's how he laid it out. And so a certain percentage of the population will never even go through positive disintegration. People who don't have overexcitabilities are less likely to have it. It doesn't mean that a person can't, but it's the overexcitabilities that drive it. Some people just have the unilevel type. It doesn't drive what would become self-actualization. But for some people who really have a drive to develop themselves, and this is who I think this theory is for the most in terms of being a helpful lens, is some people are always seekers. I know personally, from my earliest memories, I was interested in philosophy, interested in existential issues, and grappling with the issue of death since I was 7 or 8, as a serious concern in my life that adults never wanted to talk about. That's the kind of kid who this theory is probably most helpful for, or adult, people who really have existential struggles. And so there is tons of overlap with the idea of self-actualization. The dynamisms in organized multi-level disintegration have significant overlap with the characteristics of self-actualizing people. And so definitely, inner transformation is really the heart of this theory. And that's where all the meat is, so to speak. That's where it's most interesting to me. And again, values are at the heart of it. And so, people who are guided by universal values are people who can change the world.
When we talk about intensity, things like emotional depth, sensitivity, strong moral conviction, those are often either idealized as a sign of greater insight that somebody has or pathologized as something to be managed. But both of those extremes, I feel are very limiting. How do you feel we can talk about these things in a way that's both validating and grounded without slipping into either romanticizing or pathologizing?
That's a great question. It's definitely something that I grapple with because I feel like part of the problem with this theory is that it gets used as like a kind of spiritual bypassing for a lot of people, and so I think it's really, it's hard to even answer this. I'm just like thinking for myself, like I just always had to cultivate like a grounding practice of like not doing that and seeing clearly and trying to see multiple perspectives, hold multiple perspectives. Like, when I think back on my past, like I said, like I mean, obviously I was going through times that could be considered mental illness. I mean, I was really struggling. I was an addict. And yet, this lens gave me like a much more compassionate understanding around like those times of ambivalence or those times of like self-sabotaging behavior, especially that I used to feel so much shame about. And now I'm like able to see it through a new perspective that really has been more helpful than just thinking of it as like, from the DSM. And, I was given so many different diagnoses and like took so much medication. And the thing that helped me the most was when I decided to take things into my own hands to some extent and be in charge of my own development. But that was really hard. And it took years of like meditation and various practices to get my nervous system to a point where it wasn't like constantly derailing me. So yeah, intensity is really hard. It's not easy to live this way. It's really, that's why, my co-host Emma, like her blog is Tragic Gift, because that's what he considered it. Like, it's a blessing and a curse to be this way. And like the biggest gift you can give yourself is to really invest in learning how to tend your nervous system and how to live with it in a way that isn't harming you or other people, which is easier said than done.
You mentioned about your personal experience as you've learned about this theory and about how it applies to yourself. But of course, there's also this professional side of it for you that has also been a process and how your understanding of it has evolved over time. Where do you see the understanding of this going next? What are the things that you're thinking about?
I mean, next steps for me personally are to, like this summer, I'm presenting at the Society for Qualitative Inquiry in Psychology, and I'm so excited to talk about the theory and autoethnography because that's the kind of work that I do, and I'm going to be talking about the method that I use and I have used to study my life and that I use with other people who also do a lot of writing. Like I've written a journal since I was 16. I have a ton of personal data that I've worked with. And so that's been like my path of exploration with it. But when it comes to like professionally where to go with the theory, I think it has huge benefits for clinicians who want to work with it. But beyond that too, I mean, I think like this is just another framework that goes hand in hand with neurodiversity, like neurodivergence really. But, the neurodiversity movement, I think that this is just another natural lens that fits. And it also is great for people who have gone through like spiritual experiences that they may pathologize. I mean, that was just another whole aspect of Dąbrowski's work that's been kind of missed, is that he definitely saw this as an issue for that population too.
Chris, I'm so thankful for you taking the time to talk to me today. As we bring our conversation to a close, I do have one last question for you. If you were talking to someone who was in the middle of their own disintegration, they're struggling, they're questioning, maybe even feeling like they're falling apart, what kind of reassurance or insight would you offer them? What would you want them to hear?
Well, that they're not broken, for one. You're not broken and you're not alone. That's a big part of the work right now, is just bringing people together in community around this, but in ways that are safe. Like, gosh, that would be like another whole rabbit hole to go down. But again, like not spiritual bypassing, but authentic and supportive and safe. And I just want to say, if it's okay, like, I'm just so glad that we can have this conversation. I mean, when I first came to the field, it just felt like I was so under fire in some ways. And like, just had to constantly remind myself not to make people enemies and to just have an open heart and mind and that things would just naturally work out the way that they should.
Dr. Chris Wells, founder of the Dąbrowski Center and host of the Positive Disintegration podcast, thank you so much for your time today.
Thank you so much.
Overexcitabilities were one of the first ideas that helped me feel like I wasn't too much, that there was a reason for the sensitivity and the intensity and the big emotions that I felt. And I'm grateful for that because it gave me a way to understand myself and the students and clients I work with. But over time, I've seen how easy it is for those labels to become a stopping point, to say, oh, that's just OE and move on, without asking what real support someone might need. That's where ableism can quietly creep in, not out of malice, but when we separate giftedness from neurodivergence as if they don't overlap. When we do that, we can also miss what the positive in positive disintegration really means. It doesn't mean the process feels good. It doesn't mean the struggle or intensity is easy or desirable in the moment. It means that growth can come through the messiness, through the breaking down of old ways of being so something new can take root. When we let go of either-or thinking, gifted or neurodivergent, strength or struggle, we make space for that kind of growth. And we make space for supporting people as their whole, authentic selves. I'm Emily Kircher-Morris. I'll see you next time on the Neurodiversity podcast.
We're grateful to Chris Wells for joining us. We have links in the show notes to all the work and all the information that we talked about in the episode. If I had any skills of prediction, it would be a sure bet you'd enjoy being part of our social media community. We're on all the platforms, and we have a vibrant Facebook page and a group as well. I'm putting all the links in the show notes, so go ahead then. Our host is Emily Kircher-Morris. Corey Orrick is our office manager and production assistant. I'm the executive producer, Dave Morris. For all of us, thanks for listening, and we'll see you next time. This is a service of the Neurodiversity Alliance.